Ms. Jernigan, do we have a quorum?
Yes, sir, you do.
All right. Who's on the line, please?
Okay. Mr. Fergus, Ms. Mood, Mr. Jenkins, let's see, Tanisha Gibbons, Leroy DeChance. Did I say Mr. Jenkins? I did, right? And I think that's it, sir.
Okay, so you have
Joe Sanchez from RATP Dev also.
Okay, so we do have a quorum, and
Yes, sir.
Great. Mr. Ando is in the room.
Yes, sir.
Okay, very good. Hold 1 second. Let me look at the agenda. Hold 1 second. Before we adopt the agenda, I would like to talk about a phase program 2 for the ad hoc committee, and ask Mr. Fergus to be a part of this also because he is Rick Wade is in. Okay, great. Okay, so I've asked a couple individuals to chime in, because I feel that we are in a situation where we have to do a phase 2 of how we move forward with the COVID crisis that we're experiencing. So instead of going through the agenda, I want to amend the agenda and ask for adoption to talk about phase 2 of the vaccination. So if we can just make sure we amend the agenda, and I want to lead this information immediately, because I have a few people that's chiming in, and I want them to have an opportunity and be respectful of their time. So,
Mr. Chairman, I move adoption of that amendment to the agenda.
Can I get and I will second that. All in favor, aye?
Aye.
Aye. Thank you. So at this point, adoption of the minutes of the previous meeting. All in favor, aye?
Aye.
Great. Excellent. Okay, so now we go into the agenda, and I appreciate Mr. Rick Wade. Mr. Wade, would you at least give a brief bio of who you are, and we'll move forward.
Well, Derek. Well, thank you for allowing me to join into this conversation, and I'm here to listen and learn and offer any support where I can. Some of you may know this is my home, South Carolina, here in Richland County, Columbia, but also live in Washington, D.C., Senior Vice President of the United States Chamber of Commerce, where I lead all of our strategies across the private sector in America, particularly around how we engage diverse communities, policy issues that we advance on behalf of business and industry in America, not just on Capitol Hill, but by way of our state and local chambers across America. More specific to this conversation, I'm also one of the principals in what's called the National COVID Collaborative. This is a coalition of governors, of state and local officials across the country who are working to put forth solutions right now that can address the challenges that we've all seen play out with regards to the COVID pandemic. I'm particularly interested in important areas that I imagine you all are leading and talking about as we think about vaccine hesitancy, particularly among Black Americans and other communities of color, rural communities. How do we make sure that the vaccinations as well that are front and center, a part of the solution, get to people, that we can get these vaccinations done. And so I'm here to offer any insight that I see on the national level, more specifically, again, to be involved here in my own home community and how we can end the pandemic And again, moreover, make sure that folks have access. And there's a whole set of issues I'm sure that you've talked about with regards to just access that we have to deal with to make sure that everybody has full access to these vaccinations. So with that said, I'll stay on pause, listen and learn. I'm here to be supportive in whatever way I can.
Thank you, Mr. Wade. Okay, so at this point right now, what we've done as far as doing barriers, social distancing, defumigation, all those things to ensure that our passengers and our drivers have been safe. And I think Mr. Deschamps and his team has done, and Mr. Ando and his team have done a great job at that. And Mr. Deschamps, I really do appreciate your diligence on how you worked over the last 9 months to ensure that the drivers and staff are safe. I want to put that out there. But we're at the situation now where the vaccination is there. And I'm going to speak very candidly for the next couple of minutes. The vaccination is there. Now it's time for us to ensure our drivers, our passengers of the families that are riding these buses get this vaccination. We have to dispel the skepticism, and we have to get out there and market this thing across our counties, Lexington and Richland, to ensure that individuals not only know the importance of the vaccination, that's phase 1A, the importance of the vaccination, and giving education and having the right people that talk to those individuals. We're not talking politicians, we're talking pastors, we're talking community leaders, we're talking our local pharmacists, we're talking our doctors, getting those individuals motivated to ensure that we dispel that skepticism of this vaccination. Once we do that, that's phase 1A. Phase 1AB is to ensure that we get our urban planners in a room and figure out how we design routes that are directly going to CVS's, Walgreens, Prisma to ensure that this vaccination is taken. I want to have all access to the point where direct routes. And also there's subsidiary where we can set up vaccination points at our transit center, at our transit hub. And I'm going to be very diligent in ensuring that happens. Ms. Mood, will you please chime in?
Yes. I'm on board with you all together, and I think there are some things that are developing now that may move us along on this. I understand. I watched when Prisma made a presentation to the DHEC board asking if they have right now more supply of the vaccine than they have demand. And so they are asking for permission to proceed into the 1B priority group. And that gives us a starting point because that's our drivers. Those are our drivers. And so I think one immediate step that we can take is to have John working closely with Prisma, as I know they are already, to be sure that our drivers are in the loop on if they're given permission to move into the 1B group, that our drivers are in the loop on that. The other group that we can help them access in the 1B group are our DART riders, because a number of them will be in the over 75 age group that are with existing medical conditions, and we certainly have access to both the list of the people who ride DART and who meet that qualification. So that would be one place to start. And I think it helps us with what you're talking about too, Derek, in terms of getting rid of skepticism, because I think when our riders see their trusted drivers getting the vaccine, that helps. That's just one step in helping to dispel any kind of concern about taking it. Every time we see someone we trust saying, I'm getting this vaccine because I trust its safety and I know it's important in protecting my health, then that smooths the path for others. And I'll just stop at that point and let you go on.
One other point, and I have another individual that's joined, one of the community leaders that I've been speaking with. His name is Patrick Barber. The thing is, Ms. Mood, I want you to talk a little bit about your leadership role and how you roll out things in the community and get buy-in. And that's really what we.
Okay.
I understand the acts for the drivers, but it's very important for us to get out there in the community to ensure that people know and relieve the skepticism. So talk a little bit about your past and what you've seen on rollouts like this.
Oh, okay. Well, what Derek is talking about is my career in public health as a public health nurse, both on health initiatives and on working with people who are concerned about the environment's impact on their health. And so two things really come to mind. One was that some work that DHEC did when AIDS first appeared on the horizon, and that was actually taking teams of people and going and meeting with legislators, but also community folks to give just good information to the people in communities who will be the most effective messengers. And those people in the community, some of them you've listed. It may be health professionals, nurses, doctors, pharmacists, that group. It may be other trusted people, particularly pastors, I believe, and then any other community voices that people in the community have reason to trust. And that means that we have to have a network of to be able to reach those folks. And I mean, for DHEC, that's a big one because that's the statewide. For us in the COMET, what we're really focusing on is how do we find those people within our community and our service area of Richland and Lexington. And then I think we're going to have to do some sometimes one-on-one, sometimes very small groups so that we are keeping safe. But I'm thinking about things like our Transit Riders Association members, neighborhood associations, community nonprofit groups, local health departments, ways for us to tap into the network that's already there. And because what people need is to hear both the sound logic and the science behind getting the vaccine, but also somebody that they trust to answer their questions. And if we are going to expect community people to answer their questions, we have to be a part of giving them good information to act on. And I can tell you that I can assure you that the local health departments will be our willing partners in this, and they have people in both Richland and Lexington counties, working on this pandemic, and we'll, they'll hold our hands. The nurses, the social workers, the doctors in those local units to help us because that's the key. The key is that the message has to come from someone known and trusted within the community, and those people have to be supplied with sound information and a backup resource that can answer questions they may not have the answers to. Is that enough?
Thank you, Ms.
Say?
Thank you, Ms. Mood. I appreciate the passion of your rollout. Mr. Fergus, I know you have to jump off the line, but I wanted you to be part of this conversation because, like I said, we're moving forward with the rural community and getting the word out in those areas. Do you have anything that you would like to add, Mr. Fergus?
Yes, I'm thinking we do have a facility, you know, the Drew Wellness Center or the Tillis Center or the Transit Center. So in our planning, you know, the Drew Wellness and the Tillis Center will have community buy-in. And if the Transit Center, if we our administrative facility, not the downtown. If we would and coordinate all that into our employee and public, vaccination areas.
Thank you, sir. Thank you, sir. So,
Derek, I will tell you that that after you and I talked, I have reached out to 3 friends in my immediate community who all pastor black churches, to ask them what they're hearing from their congregations and from other people they know in the community about what it would take for people to feel comfortable taking the vaccine. So I'm really waiting for some feedback from them and hope to sit down and talk with them about this. So that's just one step I've taken.
Thank you. So with that being said, Mr. Ando, with the CARES monies that we have available, I am going to ask that this committee move immediately, because as we speak, one person dies every 33 seconds in America, and we just cannot wait, especially for our Richland County and our Lexington County individuals that are our constituents. So, Mr. Ando, we will be having call meetings immediate to roll out this education plan and these vaccination points access. Mr. Ando? Yes,
Mr.
sir.
Chair, can I don't know whether Ms. Mood elaborated on this, but the local hospitals are concerned that they aren't moving from 1A, that 1A is not signing up, and that's hindering them from moving to the next category with their vaccination. Ms. Mood may have some information on that.
Well, that was really what I mentioned first about PRISMA really has made a formal presentation to the DHEC board saying we need to go ahead into the 1B group, because right now they have more supply than demand for the 1A group. And so I think that does present us an opportunity, and that's why I said that that when we move into the 1B group, the 2 populations that we have the most ready access to that fall into that are our drivers as essential workers and our DART riders as people who are over 75 and have existing health conditions. So that was really what I was talking about there, because and I can I'll be glad to follow through this morning to contact the people I know at DHEC to just say where are we with that permission, because yesterday just what I heard on the news was that somebody said, well, we need to check with the governor. Well, I mean, and I'm going to speak candidly, I don't think the state health agency has to check with the governor on how to proceed with vaccines.
Amen. Mr. Barber, would you please introduce yourself to the committee and any thoughts that you have?
Good morning. My name is Patrick Barber. I'm a former Richland County magistrate. I jumped on the call late, so I'm trying to play catch up as to what was said earlier prior to me joining the call.
Well, basically, Patrick, what we've done, and we have Rick Wade on the phone too. What we're doing is being very immediate on how we move, not only with access to the vaccination, but education also. It's the same conversation. It's basically the same conversation that you and I had a couple of nights ago. So with that being said, do you have any input on this whole rollout plan?
My thoughts are that we're going to have to definitely have the education component, because we have to get people to realize that this, without taking this vaccine, whether you want to go on past historical data, we're talking about life and death and preservation of people's families and lives. So I've been hearing people say they're not going to take it, but again, you've got to get good, solid scientific data to get people out in the community to say, well, we need to do this thing because it's a matter of life and death.
Mr. Wade.
Yes, sir.
Would you
the
please,
only other thing I was going to say, the only thing I'll add is just to really amplify what Ms. Mood just said. All the research, I was just in a meeting with the National Ad Council that's going to start running ads and communications across the country, and in a deep dive about data in terms of who are the trusted voices. And she is absolutely spot on. It's the doctors, it's the nurses, it's public health officials, it's folks in that domain. And to the extent, particularly with regards to vaccine hesitancy and people of color, the more that we can connect with Black doctors, Black nurses, Black public health officials as we communicate to the Black community, and the same applies to the Latinx communities and others. The point I'm making is to make sure that we have diverse voices communicating to diverse communities. But she's absolutely spot on, and you are as well, to the extent we can tie that to access through transportation is a winning formula based on what we're seeing that needs to be modeled across the country. But that's really, really important. Those are the trusted voices, the most trusted voices around giving assurance to people to take the vaccine, to take the immunization.
So as we move on to the next agenda item, I'm asking Mr. Ando and Mr. Deschamps to chime in. I want Mr. Ando to talk about the CARES Act monies and the dollars and how we're going to appropriate those dollars to make this thing happen immediately, this rollout plan immediately. So first, I want Mr. Ando to speak on that. Then I'm going to ask Mr. Deschamps to talk a little bit about how he feels we need to roll this out.
Okay. In relation to the CARES Act, and I think, let me tackle both of those questions that you posed, Mr. Huggins.
Yes, please. And I need you to get a little closer to the mic. Get a little closer to the mic.
Do you hear me okay?
Yeah, okay, go ahead.
In relation to the CARES Act funding, the Comet received approximately $13,795,000, and then we have an additional $100,000 that we received specifically for senior transportation. And we're using those funds to pay for operational assistance. So providing the service qualifies for that. In addition, in the rural area, we have approximately $475,000 that could be used for operating assistance for areas in the lower Richland, as well as the Batesburg-Leesville area of Lexington County. So going on to the next portion, we are in communications with DHEC. We do have a very strong partnership with them. We have reached out to them about how we can assist in transporting people to vaccination. They are excited to work with us on that. As you know, we're right now in phase 1A, and phase 1A is primarily for healthcare workers as well as for home health folks, and they're presently dispensing the vaccination at hospitals. They've advised me that they're talking about a late rollout this winter for 1B, which would include the seniors, 75 years and older, and then the frontline essential workers, which includes public transit workers. And as part of our discussion, we have started to plot in our GIS system all of the available pharmacies in Richland and Lexington County, as well as all of the available hospitals in the 2 counties where they'll be having the vaccinations. And then we're overlaying that with the current comment network so we can see exactly which facilities are presently on comment routes and which facilities are not. We've also have engaged our partners at Lyft and Uber. As you know, we have a contract with them to do our Comment to the Market grocery program and our Comment at Night transportation program to see how we can access their resources to address those that are not along comment routes to connect them to vaccination, and they're interested in working with us on that. And the last piece is particularly for the rural areas where there's very limited pharmacies and medical care down in that area. We believe that doing some form of a service that models our food delivery program for those residents to get them direct access to a pharmacy or a local hospital to have vaccination is the key. So staff is prepared to, based on the direction you're providing today, is prepared to roll out multiple mobility options to connect people to vaccination. And we're starting those discussions now.
Well, one of the things that's very important, more than anything else, and Mr. Fergus and Ms. Mood have alluded to this, we have to make sure we get the tentacles out there on education. And I can't say, I know Ms. Bono Reed is in our marketing area, but we're going to have to put together a team, a strong team of individuals, whether they're firms or private firms or whatever, to get out into these neighborhoods and be able to educate, because I'm being very diligent on this, that we have to provide the word, and we have to have a trusted word. And one person cannot do it. And the longer we wait, the more people die. And I'm not as an acting chair or chair of this committee, I'm not willing to do that. So let's move very quickly, and we're going to put together a team. I'm asking Ms. Mood and Mr. Fergus to join in with me on this to ensure that we put together a team of individuals, firms, to get out in these area codes of the counties of Lexington and Richland to ensure people are educated and get these people vaccinated.
Staff can put together a marketing plan and engage our marketing resources to and work with this committee to make that happen.
Thank you. Thank you very much. All right, so as we move to the next agenda item, Mr. Barber and Mr. Wade, I know you're very busy people. If you want to do some closing remarks or just give us some encouragement, please do so at this time. Mr. Wade?
Yeah, again, as I mentioned earlier, I'm here as a resource. Let me know how I can be helpful in complementing the work that you're beginning to do here locally and across South Carolina. So count me in, and so we can end this pandemic and make sure that everybody gets the equal access, particularly to these vaccines, and break down the barriers, whether they're transportation and education are the two components that I think I can bring a lot of value. So I look forward to working.
Thank you. Thank you, sir. Mr. Barber.
I'll piggyback off of what Mr. Wade said. I'm willing to lend my resources and whatever I can do to help get out, spread the word, and let's tackle this thing and put an end to it. So any way that I can help, feel free to reach out.
Ms. Mood?
I would just two things come to my mind, and those are how important words are that we use, and from some previous experiences, I've had people say to me, when we say we're going to educate people, that sometimes gets people's backs up because they say, I'm not uneducated, I'm an educated person. And really what we're talking about is information. We're talking about getting good information to people that they can use in making their choices. So that may not be a big issue here, but that's just something that occurred to me. And the other thing that I think the key word is trust. I mean, that's what we're trying to build. That's the result we're looking for in the information that we try to get to people, is building trust, because that's what people are going to make their decisions based on, I believe.
Mr. Fergus.
Yes. And I would like from Ms. Mood, if she may have this information already, but we need to make some contact with medical providers, contractors. So if they say, well, the county can issue a vaccine, that we have everything in place and we have the money from the CARES Act to do it. Am I in the right direction?
Yes, sir. Yes, sir.
I will definitely try to make some contacts with some key people that I know, so that they can lead me to the people that we need to contact if I don't know them. So that's a good point.
Thank you.
Mm-hmm.
And I do believe we have a couple of advisory committee members on the line. I would like for you to go ahead and chime in. Is Mr. Jenkins on the line?
Yeah, I'm here.
Do you have any comments?
Yeah, one thing that, was talking about, I'm listening to y'all talk about getting the word and stuff out. A lot of people are not having church services and stuff now, but they are having Zoom neighborhood meetings once a month or something like that. And something you get with the city managers and stuff, and see could they line something up to put something on their agenda and have the mayors of the cities talk about what you're trying to get. A lot of people take what the mayors have to say, take that at heart, than a stranger that they don't know.
Thank you, sir. Any other advisory committee members on? Okay. Mr. Barber and Mr. Wade, I really do appreciate your time. We're going to move to another agenda item outside of this purview, and I really do appreciate your friendship and your commitment.
Thank you. Have a good weekend. Bye.
Now.
Okay, John. Okay, John. What's the next item, please?
I'll have Mr. DeChamp start with 4A.
Okay, good morning. First on 4A, update of the executive order. Since our last meeting, we've had, or the governor has extended the executive order, I think it's 3 times. And so that's still in effect. Also to the city of Columbia, Casey, West Columbia, Richland County, and all, they continue to have the mask ordinance mandating the use of masks in public areas. And also to the city of Columbia has increased the fine for not wearing a mask. And the town of Lexington recently added a mask ordinance. So, like I said, the governor's executive order is still in effect, and it's coming up for another extension in the next couple of days. What I will do, the next item, B, update on the Comet's operations, food delivery, cleaning. I will let Joe Sanchez update us on that, and then I'll come back and do an update on testing. Joe?
Yes, good morning. Good morning, Chairman and members of the board. Update on the operations and cleaning. For the month of December, we have 90 food service deliveries. Again, that number is scaled back due to the hot meals and that are available to the participants of the program. As of, I ran a preliminary report as of from the 1st to the 6th. We We have 6 food service deliveries, mainly due to the holidays and increases in COVID has you know tampered the operation, the program temporarily, but we look for that to increase. Um, we have 3 thermal temperature reading scanners throughout the building, 1 in maintenance, uh, 1 by the dispatch window, and 1 by the paratransit window. So we have a thermal scanner temperature reader for the mechanics, so that way they can test their temperatures. And our maintenance manager also has a temperature gun in the event that there's too many people waiting in line to check their temperatures. He can go ahead and zap them. Um, our our vehicle detailing uh, for the month of December, we show out of the reporting systems, 506 vehicles detailed, 405 units being fogged, and 1,443 units having interior and exterior cleanings for the month of December.
Okay, that's it, Joe?
Yeah, with the we did have several employees, operators, and staff members head down to Comet Central to have their COVID tests done. I'm not sure how you guys, Leroy, John, how you guys are getting the information, or whether or not you guys are aware that their Comet operators or staff, but we have several that have taken upon themselves to go down there to get their test. Because when they saw that Lovelace had, changed, the dates, they still wanted to get done. And the first thing they asked was, is the Comet still providing the testing? And I said, yes, they are. So I'm not sure what that number is, and I was just asking if you have that information, so then that way we can incorporate that into our report that we put together to show exactly what staff members and have gotten tested or waiting on tests for each department.
Oh, okay, I know, Joe, I don't have that specifically. I guess we can look at that and try to monitor that as we go forward.
Well, Mr. Deschamps and Mr. Sanchez, if I can just jump in here a minute. I think just because of the privacy laws, the HIPAA laws, that probably what we'll be able to get from the testing at the transit center will be the numbers, but we won't get identification of people because that would violate the HIPAA laws. So we'll have to rely on self-reporting from our staff. If they and we could encourage them to let us know if they've been tested and what the outcome was, and I mean even if it was negative, just to have some sense of that. But I think that's going to have to come from internal staff self-reporting.
Gotcha.
If I'm not mistaken.
That's right. I agree, and that's what we'll try to do a better job of monitoring through ourselves and also through our ETP Dev show. So we'll monitor that going forward.
Okay.
I just wanted to add a point that we do get the statistics of people who do get the testing at Comet Central. However, like you mentioned, HIPAA laws will not allow us to have the specific details, but we do have a separate relationship, as this committee is aware, with Lovelace, where they do come here and do it specifically for Comet employees. And we also get tracking data from them to that regard. So I'm very pleased to hear that Comet employees or bus operators are taking advantage of the free COVID testing at Comet Central, because that's the intent of why we did it. We wanted the community to have access to free testing to keep themselves safe and aware.
No, I agree. And we also did it so that way the rest of the the riders and the community can see that, you know, operators are doing and taking the lead, and staff is taking the lead to get tested, that it's okay for them to get tested there. And it's a safe place, safe environment, and it's going to be taken care of when they go through their process.
Good point.
And also, since August to December, when we started the testing, we've tested so far 163 employees have gone through Lovelace. I have 39 for August, 47 for September, 37 for October, and 40 for December. And the highest number is operations with 104, and our subcontractor TCS with 41. Maintenance 9, and admin personnel at 9, to total up 163 total tests conducted.
Thank you, Mr. Sanchez.
Of course.
Thank you, Joe. And that leads us into C, updating of testing. And as we were mentioning, we are offering the testing at Comet Central, and definitely it was great to hear that our staff is utilizing the system there at Comet Central. And we continue to test Wednesday through Friday from 7 a.m. to noon, and then 2 to 6 p.m., and then on Saturdays from 10 a.m. to 5. And also, too, if you look at any handout, it does give some statistics as far as the number of testing that have been done. So that information is in your packet. We also continue to offer COVID testing through Lovelace. They were scheduled this past Tuesday, but based on their staffing challenges that they have from shortages, but also to staffing that had test positive based on just the increased amount of testing and the drive-through service that they are offering, and basically at their location. We had to change that to next week, which is this coming Tuesday and Wednesday. This Tuesday we will offer testing for our employees here at the administrative building from 8 to 10:30 a.m. and then on Wednesday from 1 to 3 p.m. So we'll continue to offer that to our employees. I will be talking to Lovelace about February and March to see if they will be available. We are the only client they have right now that they're doing the mobile service for. And basically that's because of just over time with so many other sites that are doing testing and them now offering drive-through service. That's been more convenient for them based on the number of testing that they can do. So I will keep the committee up to date as far as our scheduling plans for February and March. And that concludes my portion through C. What I'll do now is turn it over to D and let John update you on the driver's barriers.
Well, while we're making that transition, I just want to say to Mr. Deschamps that I think the graphs that we got in our packet of the numbers of people that are being tested at the transit center, that is impressive, and I think it's really evidence that that was meeting an unmet need.
Yes.
Thank you, Mr. Deschamps.
All right, as it relates to D, page 8 of the packet, we continue to work with New Flyer on installing the barriers on the 39 large transit buses. And RATP has worked out a solution to flip the fare boxes 90 degrees to allow for the barriers to be installed without modification to the barriers. So we anticipate this project to be done hopefully by the end of February. The minivans, we have issued a purchase order, and I'm just waiting an installation schedule for that. On the trolley vehicles, we continue to work with New Flyer on a barrier design. I've also reached out to a secondary vendor and may have a quicker solution than the New Flyer approach. So I'm going to assess that, and if that works out, then we will, instead of New Flyers, go with the secondary vendor to get the trolleys. With that in mind, I anticipate all 91 buses should be completed, hopefully by the end of March, with driver barriers.
Okay, if no questions on the barriers, we will have Tanisha Gibbons that will update us on the DART office space and update us on that.
Good morning.
Morning.
Inside the DART office space, which includes the customer service office, we're still practicing social distancing. The masks are continuing to be worn, including while they're on the phone. The schedules have been staggered to prevent everyone being in there at one time. We're maintaining the cleanliness and also the disinfection of the office and the building. That's it, Leroy.
Okay.
Mr. Chairman,
Yes,
I keep thinking of things. I hope you don't mind my continuing to interrupt.
please,
But I just want, while we're, have our mask policy in place and people are doing that, I just wanted to let Tamisha and Leroy know something that I've just discovered recently. I ordered these little, they look like little turtle shells. They're very lightweight little plastic, like a little cage. I mean, almost like you'd think about an umpire wearing, but it's a tiny little lightweight frame that just fits into your mask. And what it does is it holds the it doesn't interrupt the sealing of the mask, but it holds the cloth out from your nose and mouth. So it is enormously more comfortable and doesn't have that kind of smothering feeling. You can hear people talk more clearly, and I'll be glad to let you know where I got those. They're very inexpensive, but I've been giving them I've about given all of mine out because I've given them to friends, particularly friends who have to wear a mask all day long in their work, and so I just didn't want to forget to mention that, and we can follow up on it later if you're interested.
Yes, we're interested. If you can get us that information, thanks.
Okay, I'll just email to you what I ordered, and because that's the only product that I have any familiarity with, but I'll do that afterwards.
Okay, thank you.
thank you, Ms. Lou. Mr. Adler?
Yes, on to F. We talked briefly about F, vaccination and impacts on public transit. We're just waiting for 1B to begin, and we have received information on how that would apply for public transit workers. So we would coordinate with RATP Dev as well as our internal staff on that once the final guidance for 1B is ready. Page 9 and 10 gives you kind of a summary of the phases of how DHEC intends to do the vaccination. Page 10 gives you an idea of that DHEC has 146,250 doses, and as of today, or as of yesterday, excuse me, they've utilized 41% of that. So there is a growing concern that there is too much supply versus demand, and that there's a need to go into 1B as soon as reasonably possible. And we'll continue to work with this committee based on the earlier discussion on service delivery of how we're going to get people to vaccination once 1B comes into play. And we'll also start working on putting together a marketing plan of how we're going to market to the community, including outreach to churches, social service agencies, neighborhood associations, transit riders associations on promoting this effort.
Thank you, sir. Thank you. Thank you.
And Mr. Chairman, I'll jump in one more time. And as I know John can't take action until there's some official word that the 1B is we can extend to 1B. But I would encourage him to just make a call to both to his Prisma and DHEC contacts today, saying we are ready to supply people for that 1B population from our drivers, and to facilitate our DART riders getting into that service, so that they know that we have really a waiting line as soon as that comes through.
Yes, we've already done that conversation with DHEC, but we'll definitely do that conversation with Prisma I've not reached out
Thank-
to Prisma as of yet.
Thank you.
I would like
And
to
John,
ask.
John, any help you need with Prisma, I have a direct contact with one of the vice presidents there, and also board member of Prisma also. So we can, if you need any help making that happen, let me know.
And I don't want to leave out Lexington Medical Center either, because I think they may be experiencing the same thing.
Yes, I have actually reached out to Lexington Medical since they pay for common service already, so.
Good, good.
But yes, Mr. Huggins, your contact at Prisma will be helpful, because I think the contacts we have is with community relations.
Thank you.
I would like to ask, though, the committee to give us a formal action to direct staff to go ahead and implement some form of transportation program to connect people to vaccination. So we have that formal action, if that's okay, Mr. Chairman.
I would move that we authorize staff to do that.
And Huggins second. All in favor, aye.
Aye.
Aye. Thank you.
Perfect. We will present a service, as I mentioned. We'll give a specific plan once I get those information plotted out on GIS and additional discussions with DHEC, the hospitals, on how we can make this happen, as well as a marketing plan of how this will work. And we'll reach out to yourselves, Ms. Moon, and your other contacts on incorporating their feedback into these plans. And we'll look to present this at the next committee meeting, or sooner if reasonably possible.
Well, John, this is a situation where I want this to move immediately.
Yep.
This has to happen immediate. All these actions have to happen immediately. And if I have to call a special board meeting to get the board support, that's fine. But just let me know. We're not in a situation where we can wait on this. This has to happen immediately.
Yes, we'll make it a priority here.
Okay, very good.
And we'll start those discussions immediately, and I'll keep you posted on its progress.
Ms. Mood, do you have any other comments?
No, I don't, thanks.
Okay, very good.
The
Next
last
item.
item is G is the FAR UV technology. We have reached out with Santee Watery Council of Governments. They've been able to secure an opportunity for us and Santee Watery RTA to do a pilot of this technology on the buses. So we're coordinating those efforts, and we'll share the results of how that works out at a future COVID-19 ad hoc committee meeting. And this is at no cost to the comment.
John, I apologize for not being up to date on what that involves. Would you just do a quick summary of FAR UV technology?
Yeah, it's basically this technology that you install in the center of the bus, and it shines this UV light to kill pathogens and germs that could be exposed on the exterior of seats and handrails and things of that nature.
I got you. Thank you.
We briefly talked about this at the last committee meeting, and I'm happy to reshare that FAQ if need be.
I recall that now, and I just didn't attach that name to it. Thanks.
No problem.
Well,
So we have today from staff.
I'm sorry, say again?
That is all we have today from staff.
Okay. Before we adjourn the meeting, I just want to tell staff how much I really do appreciate the hard work that has gone on for the last 9 months, especially with this COVID-19 ad hoc committee and its leadership also. And I think your staff is very, very much so need to be commended. And I'm gonna work with the board to ensure that they are commended the right kind of way. And I don't know what the right kind of way is right now, but I don't take it lightly of all the hard work that was done over the last 9 months.
I'd say an amen to that.
Thank you. All right,
We appreciate
so,
that, those comments. Thank you.
so with that being said, the next item is adjournment. Mr. Ando,
Yes, sir.
motion to adjourn.
I second.
Thank you. Thank you, everyone.
Thank
Good
you.
day.
Thank you.
Bye-bye.